The PHF is really a network of experts and people who have worked within government and also within the private sector and academia and activists within civil society. So it's really a group that can come together, bring together expertise from a diverse range of backgrounds very quickly to look at a problem and potentially to fill gaps in the sort of problem-solving process for both private and public sector responses. So essentially, it's a network. It's not an organization.
So what has necessitated then the PHF's ability, or rather aim, to mobilize and meet the threat of COVID-19?
So one of the threats, there are a number of threats. Obviously, we're experiencing them every day, and in many instances, government itself is so overstretched that it can't actually reach all of the problems that are key to the system as a whole. But the Progressive Health Forum tends to focus on the health-specific aspects of the COVID response and looks at both the public and the private sectors. And within this particular pandemic and within the South African context, we essentially have to bring both the public and the private sectors a lot closer together to deal with the problem in a holistic way. But what we are seeing is that it is very difficult for government to actually build that bridge. And in many cases, the private sector itself is quite exasperated in trying to build the bridge itself without really much support from government. So what we've been trying to do through the Progressive Health Forum is to find ways of solving that problem, both through what the private sector can do itself, but also to look at where the most appropriate government responses might be and to advise on that, but more particularly to find out solutions that don't necessarily need government as well, because there are many of those too.
And having said that, Professor, even though the private medical health practitioners have expressed their willingness to show solidarity in a national crisis, but it sort of has generated little traction from government. Why is this? I mean, what kind of response or reaction are you expecting from the government?
So, yeah, there are a number of problems. So one of the concerns is that as the epidemic expands and grows and the trajectory increases in many areas, the problem is that the public sector health platform is not going to be able to cope with all the patients that it's seeing. And the public sector patients are potentially going to have to be seen by the private sector as well. And it was hoped that over the period from sort of 27th of March to now, that a framework would have been established for a public-private response, a coordinated response. But that has not been finalized to date. And part of the problem with this environment, the situation we find ourselves in at this point, is that the private medical practices themselves are in enormous distress and difficulty, which means that their ability to come forward and meet this challenge for both public and private sector patients is going to be quite difficult unless solutions are found to stabilize the sort of distress of private medical practices overall. But also the way in which government will make use of private platforms is quite difficult, hasn't been finalized. Some solutions are on the table and close, but it is not necessarily a very clear picture at this point.
Is the solidarity that the private medical practitioners offering in a financial form and comes at a certain cost to government? And if so, is it then correct to assume, Professor, that the government's apparent reluctance to engage the private sector and the private medical practitioners on the private medical system, which by all means exceeds the capacity of the public health system? I mean, do you think that that's the reason that the government is reluctant to engage you, because it is already overburdened by the capacity, or rather the needs, of the public health care workers?
Yeah, so part of the sort of the response from the private sector is to offer assistance to government. But one of the problems with the public sector at the moment, or historically, is that they have never really developed the platforms for engagement with the private sector. They have never really been able to contract or interact. They haven't really done it very efficiently. They've never established it, and it's largely provincialized. And different provinces have different capacity to engage. So a very simple way of saying it is that government actually lacks the bandwidth to fully develop the relationships to the extent that is required for urgent response in this case, and even for longer term needs. So,
yeah,
essentially,
in as much as it ostensibly lacks the bandwidth to form meaningful partnership with the private sector. But then the gist of my question, Professor, is the kind of solidarity or assistance that the PHF and private medical practitioners want to offer to the government come at a cost to the government? And would you really overlook the expectations that the government is financially overburdened?
Yeah, so part of this, the proposals that have been examined is really, first of all, to make sure that the financial stability of the private sector is stabilized through medical schemes without government assistance. And that has been one of the problems during this period, and it's largely due to an anomaly of the way that the private sector is funded, in that they're largely fee-for-service. And there's been a very significant drop in patients during this period. And that has made it more difficult for medical practitioners to step up. If their private practices are going to close, then essentially they will not step forward very easily unless they're fully remunerated. So part of the issue is really solving the financial problem on the private sector side so government doesn't have to solve it. And then it's a lot easier for private practitioners to actually step forward in different ways. And it's not necessarily to step forward for full remuneration. Everybody is it's well understood. Government is in no position to properly compensate the private sector for public sector patients coming forward. And private sector will have to step up and indirectly or directly cross-subsidize the public sector patients. That is certainly in our interaction with the private practitioners as well as with the hospital groups, is that they are prepared to do that. So and are respecting the fact that the state is not going to be able to fully fund the sort of the complete health response. So the key requirement is to mobilize the resources of both sectors so that the entire system is stable when it provides the support.
Now, the South African Medical Association says that private practices have seen a 60% average decline in patient numbers during the hard lockdown. Why do you think this is the case?
Well, patients are concerned about, so during the period of the lockdown, there's a fear factor in going to medical practices and to hospitals. But there is also the cancellation of a lot of elective surgery and elective hospital-type treatment in order to create space for COVID patients, both those who are on medical schemes as well as the potential public sector cases that might come across. There was an assumption that these arrangements would be finalized quite a while ago, but essentially private sector facilities are preparing to treat a lot of people. So that drop in demand is for both a fear factor as well as for the deferment of treatment. But there's a further factor that's also impacting, is that as this epidemic picks up, a lot of practices and a lot of hospitals are closing temporarily because of COVID infections to frontline workers. So this happens to both the private sector, it happens to the medical practices, and it happens to the public sector as well. So during all of those periods in the private sector, every time they stop seeing patients, effectively their revenue goes. So there are basically medical practices of thousands and thousands of small businesses, and their revenue really depends on patients. So essentially a solution has been looked at to ensure that the medical scheme funding mechanism is altered slightly to ensure that there is advance payment in respect of expected patients throughout the year. So there's a stable base of funding, regardless of patient activities. And that's really the kind of framework that's seen as de-stressing the financial position of these thousands of small businesses in order that they can actually now reasonably comfortably step forward to provide support to public sector patients as required. So those agreements, the SLAs, the sort of service level agreements with the provinces are being finalized, as well as the clinical criteria. It is complex, the referral processes are complex, and stepping forward involves a high degree of risk. It's also important to note that a number of private doctors are willing to service public sector patients for free, but are concerned that if they go onto public sector platforms without any kind of professional coverage for providing the professional services. They could be sued. Those kinds of issues need to be protected against those as well. So all of these form part of a sort of a complex set of agreements that need to be finalized. Otherwise, it's quite difficult to step forward.
Seeing that the government is apparently reluctant to engage the private sector with regards to, fighting the coronavirus, so what other alternative mechanisms does the PHF have in terms of, engaging productive engagement, rather, on the future of the health system in the country?
So let's say, firstly, that I don't necessarily think that the government is reluctant as such. I think that in many cases, the government lacks the capability to step forward in a way and solve the problems of a private-public coordination. So part of what we've stepped in to do is to try and solve those aspects of those problems. I think that at a certain level, they will be resolved, but they will be solved in ways that are a little bit crude in the short term. But I think that a major part of it is de-stressing the medical practices, and that will go a long way toward actually solving the problem of government side. But I do think that we have to get prepared rapidly now, because we're within about 2 weeks in provinces like Gauteng, and we're already behind the curve in Eastern Cape, when we actually need our full systems available to all COVID patients. And it's also important to note that COVID patients are in public sector facilities at this moment, and the number of medical scheme members in ICU and high care is growing by the day. They are also, they haven't faced, that hasn't asymptoted, it hasn't faced the decline, it's continuously rising. And if it continues to rise at the current rate, the number of ICU and high care beds available in the private sector will actually be used up by medical scheme patients within the next 2 to 3 weeks. It's unlikely, and hopefully it doesn't increase at that rate, but at the current rate, it's so rapid that it's actually concerning. So we really do need to combine both the prevention and the treatment strategies for both the public and the private sector, and fast. And it's not really happening at the speed it should.
And Professor, seeing that we're moving so dangerously close to the peak of this pandemic, well, some health experts have actually suggested that we are already in the peak of this pandemic. So what are some of the areas of concern that all the stakeholders should lavish much attention to, seeing that we're already in the peak of this pandemic? Should it be in the tracing, should it be in the testing, or the provision of ICU facilities, or even quarantine facilities, or the heightening of efforts to provide much more quarantine facilities and beds?
Effectively, we need strategies for prevention as well as strategies for treatment. But if your strategies for prevention don't succeed, our strategies for treatment are going to fail regardless, because we can't cope with the kind of epidemic that results from failed prevention strategies. So it looks at the moment as though the Western Cape strategies have borne fruit, that in fact they have reached the peak and are in decline. But note that it's not the peak. The peak that they've reached is entirely due to their prevention strategies. And the worry is that in the Eastern Cape, Gauteng, and in KwaZulu-Natal, that the prevention strategies are failing. And as a consequence, we're not in a peak, we're in a rise, a steep rise, and we don't quite know when it will asymptote and what will make the epidemic turn down. But if we carry on like this, we are going to be unable to treat all the patients in both the public and the private sectors within about 3 weeks in a province like Gauteng. And we're already very close to that situation in the Eastern Cape. So the problem is that we need to have our prevention strategies work. We cannot just depend on treatment, but we need the treatment facilities to be available to all. And that's not ready yet. And we also need to have prevention at a much greater intensity. And if the testing and tracing strategies have continued to fail the way they have done, we are going to lose the battle. We can't win it with treatment. We cannot. We have to win it with prevention. And the testing and tracing strategies can't get to the scale at which we can get a preventive effect anymore, which means we have to use every other measure possible to beat the increases in the hotspots, targeted measures at communities that actually deal with hotspots as they're occurring, Even without testing, you can still do a lot. But we will need to quarantine people. We will need to separate. We need an aggressive prevention strategy, and it's not clear that it's there.